Hey family, Gary Johnson here, Ethel Powell's grandson. And I've got here two guests, James Gary Sr., you all should know him, and Dr. Fredrick Douglass Clark, named after the famous abolitionist and civil rights advocate. Dr. Clark, Uncle James, over to you, Uncle James.
Okay, thanks, Gary. Dr. Clark, I want to thank you for joining and sharing some of the important health information with the family. Our family has a history of colon cancer and colon polyps. African Americans have a higher rate of cancer than any other population group and face greater obstacles to cancer prevention. These obstacles to cancer prevention can include low-paying jobs and lack of or less comprehensive health insurance, lack of access to healthy and affordable food, low-quality education, and an unsafe environment. I've been a colon cancer survivor for over 33 years. And had it not been for my health insurance, I would not be here today. My treatment plan included receiving chemotherapy twice a week for a year. And this type of treatment is unheard of today. So my question to you, Dr. Clark, what are some of the symptoms and signs that we should be aware of that may be a sign of colon cancer?
Thank you very much for allowing me to address your family. Colorectal cancer is very common in the African-American community, more so than other races of people. And you've alluded to a number of those reasons. We talk about access to care, access to an understanding of different disease entities. This one in particular has a lot to do with diet. Has a lot to do with understanding of the need for early detection and treatment. Signs of symptoms of colorectal cancer can be changes in bowel habits. You can either have diarrhea or constipation. You can have pain in the gut. You can have stool changes, those type of things. Typically, you look for people to have an understanding of what the interventions are. And the interventions typically are the recommendation of having colorectal cancer checkup at age 45, screenings at age 45. What they're going to be looking for, changes in the colon, if you do a colonoscopy, they're going to be looking for the presence of polyps. They're going to be looking for changes in the behavior, bowel habits. And you can do at-home testing for colorectal cancer. There's a product called Cologuard. What it does, it detects DNA changes in cellular tissue from the colon that will tell you whether or not a person is prone towards having colorectal cancer. Also about polyps. Polyps are growths that occur in the colon. They can either be benign or malignant. Malignant means that they are more likely to spread, may cause metastatic disease or cause or death. It can be lethal. When you get a colonoscopy, of course, they look at the inside of the colon after it's been, cleaned, and they will take out tissues that appear to be pathologic, such as, polyps, and they can determine whether or not you're at risk for further disease, a need for surgery, or whether it can be a situation that may be far worse, like we had with the actor from the T'Challa. What's the gentleman?
Boseman, Chadwick.
Yeah, Chadwick Boseman,
Yeah.
who's less than 45 when he determined he had colorectal cancer, and he died from it. So this is very serious. In African American community, sometimes our diet, what we are eating, may contribute to colorectal cancer. They talk about a substance called TMAO, and basically this is formed a lot of time by the consumption of a lot of meat products, a lot of the byproducts of processed meats, and we can look at diet in relation to over time, what we're consuming, we can, and along with the detection and treatment, we can eradicate some of the problems we're having in the African American community.
Okay. All right. So that's some good information that that our families should adhere to. Also, Dr. Clark, in the United States, Black adults are nearly twice as likely as white adults to develop type 2 diabetes. My question is, could you tell us what is prediabetes, type 1 and type 2 diabetes, and also how big of a factor is drinking sodas and being overweight in the fight against diabetes?
Okay, I'm glad you asked that question, because I think that our understanding in the African American community of what we call cardiometabolic disease is very low. We don't have a great association between our diet and those conditions, be it heart disease, be it obesity, be it diabetes. Diabetes in and of itself is not a diagnosis by the word. People don't quite understand that that's a conglomerate of different conditions that occur because of the fact that our body does not have the ability to process our primary nutrient, which is glucose. So if we look at the energy source that our bodies are utilizing, they're utilizing glucose. Every food source, every major macronutrient that we consume ultimately is going to be converted to glucose. Now, someone will say, I have diabetes or prediabetes, and they'll be given an explanation that their blood sugar is high, or if they get what we call a hemoglobin A1C, that number is elevated. But what's occurring is that as your body loses its ability to properly process sugar, then you start to develop those conditions associated with diabetes, meaning high blood sugar. You see in diabetes that you have high urination, you have consumption of large quantities of water and fluids and whatnot. And basically, what's going on is that your body is losing the ability to properly utilize sugar to create energy. Overutilization, or overconsumption, I should say, of any food sources ultimately create more energy in the body than you need. What happens when you create more energy? Well, either your body cells are going to use it, or the body's going to convert it to fat. And once that begins to happen, then the system really begins to back up. In other words, the insulin cannot keep up with the amount of sugar in the bloodstream. That you don't burn, it will convert to fat, and that leads to obesity. But as you create more and more insulin, then you create a situation where the body can't keep up with the insulin needs, and that's when you go into full-fledged diabetes. Now, what is the difference between prediabetes and diabetes? You're producing a high level of insulin in prediabetes that's able to keep the blood sugar level down. When you go get a blood test, it'll appear that your blood sugar levels are in a normal range. But if they were to test your levels of insulin, they would find that your insulin levels are greatly elevated. That means that the pancreas is overworking in its production of insulin. So if they were to test for insulin levels in a person who's quote unquote pre-diabetic, well, they see that what you develop what we call insulin resistance. That's why your body creating all this insulin, but you're not able to get into the cells, and that's why at some point or another it's going to push you over into diabetes, because the body is not going to be able to continue to create the level of insulin. Prediabetes and diabetes are conditions that actually have the ability to be reversed if you begin to turn back those type of things that you're doing in terms of diet, nutrition, and consumption. Consumption of foods that are high in carbohydrates. Consumption of foods that have the ability to create more sugar. And I use the term more sugar because of the fact we talk about different types of food, be it fruits versus vegetables versus processed foods. if you are talking about a term, we determine food's value in terms of the amount of sugar created by what we call a glycemic index. And a glycemic index simply breaks down foods according to the amount of sugar that they impart when they break down in the body. So you'll find that starches and fruits are going to create more sugar versus vegetables and proteins and fats. So did I answer the question?
Okay, yeah, it sure does.
All right.
On the same subject here with diabetes, can you help us understand the impact of sugar and excuse me, specifically define sugars in terms of fructose, sucrose, and simple sugars?
Okay, so when we hear sugar, most of us think of table sugar or white sugar. And I will explain to people that white sugar and brown sugar are basically exactly the same thing. Sugar is what we call a disaccharide versus what we call monosaccharide. So a disaccharide has two sugars linked together, fructose and glucose. Glucose is a necessary sugar that our bodies utilize for energy, whereas fructose is a sugar that the body does not utilize, and it can have deleterious effects when it's in higher levels than your body utilizes. In other words, a fruit has what we call fructose, which is called fruit sugar. But since table sugar is a molecule of glucose plus fructose, when that breaks off, if you have a say a piece of fruit has fructose, and you also have what we call fiber in fruits and vegetables. So even though fructose is there and the body doesn't utilize it, the fiber helps to minimize the effect of fructose in the bloodstream. Fructose is not utilized, so basically it'll eventually be processed in the liver, and it can contribute to what we call fatty liver disease. Whereas we talk about monosaccharide versus disaccharide. The body cannot use a disaccharide. It has to break that sucrose or table sugar or fruit sugar. It has to eliminate the fructose, but it has to utilize the glucose. And so those monosaccharides, like glucose, I should say that monosaccharide glucose is absolutely necessary, but fructose is not. The problem was, say, fructose, and I need to make people understand one of the things about in the food industry. Fructose is something that is utilized in most foods. It used to be back in the day before fructose became popular. After the 1950s and 60s, the primary sugar used in the food industry in sweetening foods was sucrose. But when they discovered that they could get a far cheaper product to sweeten foods from corn and different other sources, they created high fructose corn syrup. And that's been the primary source of sweeteners in foods. And they have been very destructive to the human body in terms of metabolism, because our bodies don't utilize fructose very well. It helps to convert the sugars to fats much more efficiently in the body. It destroys the ability of the liver to process the sugar properly. It doesn't convert it to glucose, it just converts it to fat. So in terms of different types of sugars, I will bring up, because when we say the word sugar, I just want people to understand. What we see on our table sugar is not malt sugar. It's not lactose sugar. We'll call malt sugar, maltose, milk sugar, lactose, fructose, and glucose. These are the primary sugars that we're familiar with. There are at least I think another 4 more, if I'm not mistaken. But having said that, those monosaccharides, the primary ones that we are concerned with in diet, are glucose and fructose. Okay.
Okay. All right.
So all the stuff that we're eating, in a lot of us, in the sodas, in the condiments like ketchup, barbecue sauce, salad dressings, not necessarily good, because it all has sugar.
I think we won't use the word sugar anymore. We'll use the word high fructose corn syrup.
All right.
We should
Call it what it is.
really
Call it what it is.
separate the two, exactly what they are, because that's what's driving in the Black community, the metabolic diseases like diabetes. And people don't make the connection, but not only when you see diabetes, that's why I said it's a multifactorial disease. You also see hypertension or high blood pressure. You also see high cholesterol. You see high triglycerides. You see fatty liver. You see atherosclerosis, artery disease. You see coronary artery disease. You see strokes. You see plaque formation in artery walls. All these things are being caused by you are what you eat. Eating high fructose corn syrup. The fatty liver, after the liver gets fat, then all that is now driven into the muscle tissue, so you get fatty muscles. It's driven into the fat stores, so you get fat abdomen and you get fat arms and fat shoulders. So all this fat is simply backing up into the body because it's not being either reduction in the amount of food that you're taking in or reduction in the toxic fructose that you're taking in and the quantities. So even if you drink a soda, you're not drinking sucrose. Matter of fact, I'd much rather if a soda had sucrose in it than high fructose corn syrup, because at least one part of that sucrose is going to be glucose that your body can utilize. But what we have to understand is that at some point or another, we have to stop putting in excess calories also, because after a certain age, your body doesn't have requirements that you had before 25 while you're in a growth and development stage. If you're consuming 2,000 calories after you're age 25 years old, let's say this, 3,500 calories are required to make 1 pound of fat. Most meals that we eat meat 3 meals a day. How many calories are you really consuming? If you're consuming 3,500 calories, you cannot lose it. You can't lose 1 pound. So if you're gaining weight, obviously you must be putting on more than 3,500 calories a day in 3 meals. So now we have to cut back on the number of calories we're putting in. How can we substantively do that? We can do that because what we're looking at in terms of meals is most of your meals have carbohydrates that are meaning cereal in the morning, bread in the afternoon, bread in the evening, muffins, ice cream before you go to bed. How many calories and carbohydrates did you consume? You might have very well went over that threshold, 3,500 calories, number one. Number two, people never talk about how protein in meat is converted also to glucose. Also will be converted to fat once you reach a threshold that your body can't use anymore. So we have to begin to understand, how do we draw back from constantly putting in more and more and more calories? So if you see a man with a big abdomen, he's probably got a fatty liver. He's probably got a lot of what we call visceral fat on the inside of the stomach. He's probably got layers of fat in the fat stores outside the body. And all of this is related to how much carbohydrate, how many calories we're putting on, and how do we pull back from that to change the trajectory of our health disparities, the 5 to 7 that I mentioned.
That's submarine deep. That's submarine deep there, Dr. Clark.
And we got to go deep. Got to go deep.
Yeah. That's submarine deep. That's submarine deep there, Dr. Clark.
And we got to go deep. Got to go deep.
Yeah.
And our families don't understand. And we started out from our children. And we continue this process through adulthood. And we even see our senior citizens are still being fed the same garbage. And the food industry does not care because they're making profits.
Yeah.
Oh, can I mention about the food pyramid?
Come on.
I remember you used to look at the food pyramid, and they used to say 65% of your calories should come from carbohydrates. And they put breads right up there. And nobody talked about, well, the breads are made from processed flour. And what people don't understand, we talk about whole foods, and the body doesn't like foods that are not whole foods, because that's not how we were genetically created when food was brought to us. We were not made, the food is all pressed out into flour So now our body doesn't know how to properly process this flour that's also been genetically modified, number one. Number two, year-round, fruit was not available. Well, why do we get fat? Because we're eating fruit year-round. If we look at bears, bears hibernate. They get fat because they eat lots of fruits and berries during the time that they're on, before the hibernation period. And then all that goes away during the wintertime when they're in hibernation. Well, our bodies kind of sort of work the same. Only thing, we never find our period of hibernation. And that's why we get metabolic disease, because we're out of sync with how we were supposed to be eating. We're out of sync with, like I say, juices. There's no way that you should be giving someone an 8 to 12 ounce glass of orange juice, because an orange is healthy, but a glass of orange juice has too much sugar in it. Or any juices.
Yeah.
Sodas are completely off the chart
Yeah.
as a food source. It should never be consumed,
Right. Yeah.
especially with high fructose corn syrup.
I will say I went cold turkey with juices in 2012.
Mhm.
I was giving a seminar. A lady told me in the back of the room, she says, I noticed during break, you hit a lot of those juices back there. And she started telling me about the calories, the sugar, and I just went cold turkey
Right.
and that day, and haven't had any orange juice or pineapple juice or any of those stuff or sweet teas since 2012. And I never drank sodas. So
right. I tell people all the time, I say, if you're going to consume juice, you need about 2 or 3 ounces. That's it.
Yeah.
That's it.
wow,
Maybe prune juice.
keep you regular. What else you got, Uncle James?
Well, that's about it, Gary.
Yeah, okay.
Yeah, one thing that I'd like to say, my doctor sent me to diabetic classes.
Mhm.
And the first thing they told us in the first day, stop drinking sodas.
Mhm.
Don't drink another soda.
Right.
And I haven't drunk another soda since then. And it makes a big difference.
Well, what do you think of the people who get you get the case of soda, 12 sodas or 15 sodas, and they cost about $5 to $7. And they just consume this all day long. They are poisoning in their systems. And when we go to family reunion, we're going to see that lots of family members, they keep the Pepsi, they keep the Cokes, and they battle. The companies battle each other for your loyalty.
Yeah.
To the sodas.
Yes.
Somebody tells us no. And I always like to tell people, I say, when you're feeding your family cereals in the morning, that should not be what the meal is. That should not be what the meal is. If you're going to eat cereals, then you're going to eat whole grain cereals, not this processed stuff that you get off the shelf and pull out the box. And you know what I'm saying? So we have to begin to understand, what should a meal look like? How much should be considered in the meal? How much of that macronutrient, carbohydrates and protein, what percentage of that should be on your plate? How many calories it contributes to your overall intake on a given day? And when we start understanding those things, when we start to eat based upon those type of things, then we're going to find that the incidence of diabetes, obesity, heart disease, strokes, those cardiovascular disease, those things are going to go down. And even cancer, they're going to go down. Because the thing about the plant-based diet too, that a lot of we talk about green leafy vegetables. They talk about cruciferous vegetables, particularly like the cabbage and the broccoli and the Brussels sprouts. Those things have chemicals or phytochemicals in them that literally kill cancer cells. And if you know that every cell in the body has cancer potential, then you need to be eating foods that have the ability to thwart and kill cancer. And if you don't know these things, especially raw vegetables, if you don't know these things, if you don't know better, you won't do better. So now our job is to go to the family and say, as a family reunion, from top to bottom, we're going to know better, because we're not going to be walking around misinformed about what we should be doing to stay healthy. And if we have medical conditions, how do we change that situation? If they say don't eat salt, someone needs to tell you why salt should not be in your diet, what effect it has on kidney function and liver function, and what those conditions have to do with overall destruction of cardiovascular function, meaning arterial function, plaque formation, heart disease, or even the microbiome in the gut. We have to know what those foods, what effect they have on them. I tell people all the time, one of the reasons why you should eat beans a lot, because beans make the microbiome, make the gut bacteria healthier. Here's the thing they call tight junctions in the gut, because you've heard of leaky gut, right?
Yeah.
Leaky gut occurs because naturally you should have tight junctions in your gut wall that don't allow toxins and stuff to come out of the gut into the bloodstream. But those tight junctions, as you get older, they start to be destroyed by toxins in the bloodstream. But if you eat things that are healthy, such as the cruciferous vegetables, and you eat the beans, they cause the microbiome to become healthier and keep those tight junctions tight and help to prevent colon cancer.
Well, family, this was designed to get your attention as a wake-up call. I'm going to make sure that you learn more about Dr. Clark and how you can learn more about these topics, because he has a YouTube channel. He also has a platform on my social media site, blackmeninamerica.com, so you can learn more about these topics in more detail and learn more how you can get a consultation with Dr. Clark. I'll make sure that that is available to the family. Dr. Clark, before we exit here, anything you want to say to this family or in the Black community, or anything about yourself? Because I know you are like, you're like a crash dummy for, and I don't mean this in a pejorative, but you're like a crash dummy for the things you talk about because you've lived them. Am I right?
Let's say, yes, I am a crash test dummy for health disparities in the Black community. If you can have it, almost I've had it. Okay, I developed diabetes at age 20. I had a heart attack and had open heart surgery, quadruple bypass heart surgery when I was 40. And I've had chronic kidney disease since I was in my 30s. And I didn't think I'd live to see 50, but God has blessed me to get to 65. Because every time I saw something come down the pike, I started doing the deep dive and the research to begin to understand what is the disease process and why am I affected by it and what's going on. I'll tell you a quick story about liver disease and diabetes. When I was 20 and I was in dental school, I was about 22. I was in dental school, and I had started to develop sleep apnea, which is another consequence of obesity and diabetes. And so I went to have a sleep study done, and they did some blood work and found that I had elevated liver enzymes. So the first thing that came to their mind was, do you drink a lot of alcohol? And they didn't consider maybe something else was going on. So I had to go get liver function test and go see a gastroenterologist. And basically, after a little while, he said, okay, well, he doesn't have hepatitis. You can go back to dental school, you know. So they had literally locked me out of dental clinic. I couldn't treat patients because they thought that maybe he may have exposure to hepatitis. But as I got older, the crash test dummy started being exposed to some of these things. I said, what was going on? Because I had pre-diabetes at 20 years old. And it was not detected because a 20-year-old was not supposed to have elevated liver enzymes associated with diabetes. They were looking at something different. They didn't know that my liver dysfunction was because my liver already was not able to process sugar. And maybe I had fatty liver disease at 20 years old, but that was in the 80s. So who knew? And that's why I developed diabetes so early.
Man. All right, family. This is our wake-up call. Again, you'll have more information how you can access Dr. Clark and do your own research. Dr. Clark, thank you very much for enlightening us. I can't say anything else, but thank you. Uncle James, final words.
Well, Dr. Clark, you've been very informative.
Thank you, sir.
I hope that our family will take heed to the things that you have said And if they have diabetes, that's something that they can reverse. And they need to really start doing that. And I want to thank you for joining us.
Okay, I did want to say one more thing. Of course, I am not a replacement for your primary care doctor. You need to go see your primary care doctor. You need to have your blood work done. You need to get a baseline for where you are. And if you ever call and talk to me, then I know from what perspective to begin to counsel you.
Sounds like a plan.
Yeah.
All right, Dr. Clark, hang in there, hang on. Thank you very much for joining us.
Yes,
All
sir.
right. Thank you, Gary.